And good morning, everybody. It is Fabulous Friday featuring Garry Coles, our wonderful hypno-oncology expert hypnotherapist. Gary, you are the expert in this area, and pretty much everybody knows that. And I think your training is absolutely fabulous. I have used much of it, and in all different areas. So yeah, you know, tell us what led you to go into hypno-oncology. What was your calling there?
I think it was a bit of an accident, but like all these things, are they accidents? I mean, the main thing there is, as both my mother passed away quite young through cancer, and I also had my grandfather. I looked after him going through cancer as well, although he lived till he was 94, so not quite such a big thing. But just after I had originally qualified as a hypnotherapist, I had a phone call from a hospital saying, "Oh, we've just heard you've qualified as a hypnotherapist. We used to have one here in the oncology unit. Would you?" And they've left, and it's really useful. Would you like to come and do some stuff with us? So I thought, oh, I'll go in, and that will get my experience really good, and then I'll disappear again. And then, sort of 19 years later, I was still there. But then because I then learned a lot. I've worked with thousands of cancer patients over the years, and because I learned a lot, I knew what worked, what didn't work, devised my own techniques. And then I had a chance to study for a Master of Science degree and decided to make it really difficult for myself and decided I wanted to do medical research. Caused me lots of ethics problems, but I persevered. And I ended up doing some pioneering research into pre-surgical hypnosis and the effects that had on the recovery quality in breast cancer operations. And
Absolutely
and it
fantastic.
wasn't due to my research, I don't think, but it's interesting in the UK now, the Royal College of Anaesthetists now recommend pre-surgical hypnosis.
Good, yes, and I must say I do that with I send it out actually to clients of mine. If I hear anybody about to have surgery, I say, "Would you like this? Would you like this recording that I made?" And I mean, I know it's not necessarily personalised to them, but it doesn't matter. It still helps. And I
It
don't
does.
mind saying, Gary, I listened to them myself before I had any surgeries on my because I had my bunions done. So and
Right.
my recovery was amazing.
Yeah,
Uh,
it does give a faster both psychologically and physical recovery.
Mhm. Mhm. Yeah,
That's what my research found. So
yeah. I couldn't agree more. So you were training this. You've got a 2-day workshop at HypnoThoughts Live?
yes, it's the first time I brought it back to the US in quite a while. I've had lots of people asking me, so I thought it's about time. And I hadn't sort of done it anywhere for a little while live, but I got asked to go and teach nurses in Iceland earlier this year, and again the feedback was brilliant, and so I thought it's about time to bring it back to the US. So
Absolutely fantastic. Yeah, I love it. I love it. So what are those dates in July?
it's just before Hypnothoughts. It's on the Wednesday and the Thursday, just
So
before
that's like
before
15th,
Hypnothoughts.
16th. Yeah.
I believe it is the 15th and
Yeah.
16th.
So
Yeah.
yeah, no, brilliant. And then you'll be actually be talking about it as well at the conference.
No, I've got something different to do this time.
Oh, you've got
At the
something
conference.
different.
Yes, yes,
Yeah.
yes. Thinking outside the box is my topic this year. At,
I guess because you've seen so many people, you've just said I mean, I know you've been doing this for like 20 years. So it's like, so you must have seen thousands of people. And if you're in the hospital, all the different aspects, I expect you have to think outside the box.
yeah, I mean, an example of one, and probably most hypnotherapists would know how to get over this, and I won't explain how I did it, and I would probably do it differently nowadays. But one of the stories from that, which I also mentioned in my training, on sort of ways of sort of overcoming things. A phrase I always hate to hear at the hospital is, "Oh, we booked a patient in for you. The counsellors think it will be a good idea." That means the person's had months of counselling and got nowhere. And they phoned me up one day and they said, "Oh, we've got a patient booked in for you. You're the hypnotherapist. You deal with fears and phobias, don't you?" And I said, "Oh, they realise what we do at long last." And I thought, yes, I can deal with that. And they said, "Oh, we've got a lady with a sleep phobia. Could you work with that?" And they said that she's frightened to go to bed at night. She has to be sedated to put her to sleep at night. There you go. We've got a little not very well cat here,
I know.
and she has to be sedated at night. And the reason behind I won't go, but she was a very religious lady, and she had hallucinations due to the
Okay.
anaesthetic,
Hmm.
and she saw herself dead in bed, and that freaked her. But anyway, I thought, yeah, I can deal with that. That's standard. and they brought her down to me, and she's walking around my office, which I thought was really strange. And I said, "Oh, what's going on? This is a bit strange." They said, "Oh, her phobia's got a lot worse." I said, "In what way?" And they said, "Oh, she's frightened to sit down, relax, or close her eyes." And I'm thinking, how do people think we work as hypnotherapists? So that was my first case of thinking outside the box, having a client that couldn't sit
Yeah.
down, relax, or close
I
her
know,
eyes.
and Gary, we had a conversation before as well about of all the people that you've trained, because you must have trained hundreds of
Oh,
people
yeah, quite a few
in
hundred.
yeah, and you said to me that you had at the very beginning that the two complaints you had about your workshop were
Yeah.
actually was like one that you spoke about too much about cancer.
Yeah, so they've got a Hypno-Oncology course, a course on working with cancer patients. They complain that I talk too much about cancer. Well, that's what the course is called. And I had somebody else saying, "I signed up to a cancer course and you taught me loads of techniques that I can use with everybody and all sorts of issues." And I thought, well, isn't that a bonus?
I know. I think but isn't that great? I mean, if that's the worst you get,
Yeah, yeah, yeah.
I mean, they're good.
That's the only two negative feedbacks, or slightly not positive feedbacks I've ever
Yeah.
had out of hundreds.
I know. I mean, and this is the beauty of it. Actually, is that when somebody takes a workshop from somebody who is so knowledgeable like yourself, you can adapt it to everything, because it's like the control room is one of those things that is adaptable in everything. I use that when I don't train it in the bunny talk process, but I use it with my clients. And it's there's so many things that are adaptable, and I know you trained in the bunny talk process.
Absolutely, yeah, yeah. And again, it's an excellent process, and I take elements from it to use with my patients and my clients. And it's one of the things that I think is useful with whatever you're learning and whatever techniques you're learning. And I always encourage the people that I teach that here's how I do it. Now go away and do it your way.
Yeah,
Take what you think is really useful from it and adapt it, because I've had people that ask me to teach them exactly what I do with things, and then they'll say, "Well, I'm not getting the same results." That's because you have a different personality, a different style. You do things differently. So I encourage people to learn, whether it's learning hypno-oncology, whether it's learning the excellent bunny talk process, things like that, and then use what resonates with you, but adapt it to the way you work, and you'll have much better results that way.
that's right, because you're using your little nuances, your stories behind it to make it, and so that you can remember it better as well. Anyway, and you're just adding in. Plus, you're adapting it to the client.
Yeah, absolutely. Yeah,
Everything has to be person centered around the client that we are seeing. So, it's if the client is sort of like very quiet and what have you, so you will temper yourself down as well, gradually, because we're pacing, we're doing so many different things. And it's so exciting, and I love what we get to do and what we get to train, because it's like, yes, we know that so many people do fabulous work already, but I mean, I like to learn more things, and you clearly did too, the bunny talk process, and it's just like, well, what else is there? What else can I do? What can I tweak? Oh yes, that would be really great for that person. And
yeah.
because it's not one size fits all, and it's just not. So there's so many aspects, like you just said, from that person who made that disagreeable comment. You taught me things that I can use in everything. And as we were discussing before, same with the bunny talk process, because I do all that emotional intelligence coaching.
Yeah, which is excellent. Absolutely, yeah.
Yeah,
It's stuff that you need to know, or I think you need to know.
yeah, exactly. And Beryl Comer, she taught me lots of it. So and we all say yes, Beryl Coma. So it's like, yeah, so I just love that. So my workshop is after HypnoThoughts. It's on the Tuesday and Wednesday, so it's after the conference. It's on the 21st and 22nd of July. Yours is a pre-conference, and in the middle there is the fabulous conference where you get to learn
Yeah,
from everybody.
yeah,
And
there's so much to do there. Yeah, and again, it's great. And people say, "Oh, I've been doing it for years," but you can always learn something. It's great to go and see things that you wouldn't normally be interested in. You might learn stuff, and even some of the basic stuff. I go in. I've done it, as I said, over 20 years. but I could go into a talk, and even if I take just one phrase or one sentence or one little change of a technique or a way they do things, I can incorporate that into what I do to make it even more powerful. It's surprising what little things you can pick up that you then add into what you do.
Yeah. Oh, I will. Yeah, I do all the time. Every single one. It's like, oh, I like that bit. Yeah.
Yeah.
And that's what it's about, so that we can deliver the best to our clients. And none of us are in competition. We want to help people. And
Absolutely. Yeah, absolutely.
So I love it. So thanks for being on here, Garry. And I will see, I think I'm actually seeing you in Copenhagen before HypnoThoughts.
Yes, I believe so. Yeah, because I know you were coming over here at Christmas-ish or just after, but now you're not.
No, I
But,
am still coming.
oh, you're still coming over,
Yep,
but you're
yep.
going to be in Birmingham or somewhere silly, aren't you?
Yeah, yeah. So I know. It's like well, it's all good. It's all working out. It's just how the universe works for everybody.
Yeah, but yeah, I will certainly see you in Copenhagen. So I'm doing, before I go to Vegas, I'm doing 3 at the moment. I'm doing Copenhagen, Dublin, and Antwerp before
Excellent.
I go there.
Excellent. So, and otherwise, everybody, if you're watching this, we look forward to seeing you at HypnoThoughts Live and at one of our workshops, because because we know you want to.
Absolutely.
Take care, everybody. Thank you for watching, and it's goodbye from me, Claudia Rickard, and it's goodbye from
me, Garry Coles.